Hi, everybody. Everybody's just trickling in.
Hi, everyone. Welcome to today's Tech Tuesday. We still have people coming in, but while we're waiting, my name is Vanessa with ITS Communications, and today we're going to be talking about the Patient Resource Center with Sarah Jewell, who's the Assistant Director for Clinical Services at the library. While people are coming in, before we get started, I just wanted to let everyone know that we are recording today's session. So if you'd like to share this with colleagues who were unable to attend today, who wanted to learn more, or if you want to go back and reference anything we may have discussed today, you'll be getting a follow-up email with a link to today's recording as well as any other resources that we discussed today. We also have everybody on mute right now, and that's because we're just trying to prevent any unintended background noise during the session. But if you have any questions at any point during the session, feel free to type in the chat what your question is, and we'll get to it when we can. Or if you'd like to come off the mic to ask your question, just go to the React button at the bottom of your Zoom window and hit the raise hand button, and we'll be sure to take you off the mic when we have an opportunity to do so. I am going to hand it over to Sarah in just a moment. And while she is starting up her presentation, I'm going to launch a poll for you guys. So please, when you have a moment and see the poll, just answer a quick couple questions.
Okay, thank you, Vanessa. So basically, I'm the assistant director for clinical services in the library, which actually means, in addition to the managing the Myra Mahon Patient Resource Center, I also lead a team of librarians who round with clinicians at the institution. So if everybody could just take a minute and fill out the poll. um, we're basically asking, have you ever contacted or visited the Patient Resource Center or referred someone else to it? So I get a sense of um, who is here with us today. And then also just answering a question, how you think that we can help the Weill Cornell medicine community. And we're seeing some answers trickling in. Okay, just see.
I can end the poll. It looks like most people have answered and are
Okay, great. Okay,
I'll share the
let's go
results right
ahead.
now.
Thank you so much. So basically, it looks like, well, this is a good thing that you guys have not contacted, because then we're getting the word out right now. So hopefully we'll help you either contact or visit the Patient Resource Center once you learn more what we're about. And I see a couple of you had different answers for the second question. And the trick is that the answer is all of the above. These are all things that the Myra Mahon Patient Resource Center can help you out with. Um, we supply health information in multiple languages. We can recommend better alternatives to Googling your symptoms. We provide space for health seminars. We save clinicians time by providing health education materials to patients upon request. We offer a chance to socialize with the book club focused on health nonfiction books. And we provide computer access. So I'm just gonna go now to, so basically, in short, the impact, thank you all for taking the poll. The impact of the Myra Mahon Patient Resource Center is that we save clinicians time by providing patient education materials directly to patients. We educate patients about how to search for health information and how to evaluate it. We also provide opportunities for outreach to patients through health seminars offered by Weill Cornell Medicine and NYP clinicians. So our mission is to make accurate science-based health information easily available so that patients, families, and caregivers can make informed decisions about their care. And our welcoming and inviting space is located on the second floor of the Weill Greenberg Center. And here is a view on the other side of the portrait of Myra Mahon. There's ample space to wait before or after a doctor's appointment, and we also have computers available for use at the left, as well as a staff member trained in consumer health information at the reference desk. Our full range of services are listed here, including a library of health brochures, pamphlets, and online resources, computer access, again, a place to wait, health seminars, and the Health Nonfiction Book Club. You may be wondering, though, how long the Patient Resource Center has been around and who was Myra Mahon, the center's namesake, and the woman pictured in the painting. The center was dedicated in February 2007, shortly after the Weill Greenberg Center was dedicated in January of 2007. And Myra Mahon was excited to see her legacy continued. Throughout her life, Myra Mahon put forth her incredible intelligence and passion towards many social justice causes, often rooting for the underserved or overlooked, having been born and raised in New York City herself, growing up in the High Bridge neighborhood in the Bronx. She earned her master's in social work with high honors from Fordham University and worked her way up at the United Way of Tri-State in New York City, rising to executive vice president overseeing corporate partnerships and giving. She also worked as the development director of the Archdiocese of New York and served on the board of directors of many nonprofits, bringing about positive change, including Marymount College Women in Need, New York Foundation, New York State Parks and Recreation Commission, and the Healthcare Chaplaincy, among others. So she served for many years as the co-chair of the Women's Health Symposium at Weill Cornell Medicine with Joan Weil. So it was fitting that you can see at the lower right, the most popular and sought after health newsletter that we feature at the Patient Resource Center is the monthly Women's Health Advisor from the Iris Cantor Women's Health Center. So providing information on various health issues and topics may seem simple to you in this day and age when you can Google your symptoms. But even for those of us who are clinicians, I would like us to remember that we are all patients at different times throughout our lives. And when we step into this role as a patient, we may not know who to trust for the more evidence-based information, or we may feel nervous or anxious about making decisions about our own care. As library staff, we encourage all patients to improve their health literacy by seeking out information and asking questions when faced with health decisions. There is no one-size-fits-all answer for our patients and caregivers. Some patients may have a healthcare background themselves, but may want help finding the latest research to help them make decisions about their care. Some may need additional instructions or resources when caregiving for a loved one. Some may have a deeper understanding of a health issue by reading a pamphlet in their own language or in layperson's language rather than medical jargon. So all three members of the Patient Resource Center team are trained in finding health information. At the right, you have Barbara Sievert, the Patient Resources Center assistant, and she's undergone consumer health information specialization training with the network of the National Library of Medicine. She also lights up if a patient walks in with a bonjour or buenos dias. She likes tracking down trustworthy translated health information. Allison Piazza, our clinical librarian, founded our book club about 2 years ago and draws in a small crowd of bibliophiles every other month. And here I am on the left, a clinical librarian who also serves as assistant director, and I'm pictured with my dog, Friendly. So where can you find our presence online? From the weillcornell.org website, we're listed under patient education, and we list our physical location, our email address and phone number, our regular hours, Tuesday through Friday from 10 a.m. to 4 p.m., and also point out trustworthy online health resources like Medline Plus. Keep us in mind if you need help finding information on a health issue yourself, or if you are caregiving for someone you love, we can help. We also have a YouTube channel where we post videos of past health seminars by clinicians at Weill Cornell Medicine or New York Presbyterian Hospital. Last time I checked, a few days ago, a health seminar video on shingles had received 166 views in the past 48 hours. We're always looking for new health topics and clinicians to talk to them. Um, oh, let's see. Oh, also, we offer a free space for you to offer a consumer health seminar and upload the video where you can add to your own Weill Cornell profile to draw in prospective patients. When we promote your health seminar, we market to over 650 members on our listserv and almost 15,000 subscribers. Pictured here are some of the titles that the Health and Medical Book Club have read over the past 2 years. If you're interested, you can join us on August 7th, Thursday, August 7th, from 5 to 6, where we discuss our latest book, Rebel Health, a field guide to the patient-led revolution in medical care. Patients, physicians, and bibliophiles from all walks of life come together to discuss informative and engaging books. So, and I mentioned, I'm sorry, this was accidentally slightly out of order, but we love to connect with clinicians who are interested in doing their own patient outreach. And we also do patient outreach of our own. Here's a picture of myself that Allison took as we visited the nearby Lenox Hill Neighborhood House, their older adult day center, to give a presentation on finding reliable health information online. And we've also presented briefly about our resources to disease support groups at Weill Cornell Medicine. So if you run one that isn't on our radar, please reach out, and I'll give my contact information again at the end of the presentation if you're interested in us talking about the resources that are available. We did recently survey our listserv of, again, over 650 patients and some faculty, staff, or students. And we got 96 responses. We had about a 15% response rate. And 36% of the respondents said they had attended a health seminar or book club. And then about 30% of them said that they were extremely likely to recommend the center to a friend, family member, or colleague. So here's just a brief case study, and then we can open it up for questions. A patient might walk in and her doctor has diagnosed her with type 2 diabetes, and she's asking for resources on how to stay healthy with this new diagnosis. So one nice thing is at the right, you can see we actually have a section devoted to diabetes and pre-diabetes with pamphlets on the ready that people can browse and take away if they have information needs related to this. We also have a recent health seminar that was given by Regina Hanna and Dr. Gwendolyn Jack about diabetes. So that's provided at that link there. And they can also, view the video at our center, or, we can give them the link and they can view it at home. We also have, there's information from Medline Plus, a resource from the National Library of Medicine. And it also links to a lot of other resources, such as this nutrition tips for managing diabetes from familydoctor.org. And it also has information on, testing your blood sugar, and it has instructions for that. So, and we always encourage the patients to take this information back to their care team to make sure they're, following up with them. So here's my contact information, and let me know if you have any questions. Okay.
Sarah, it looks like we're getting some questions in the chat. We have one from Chad. Is the use of the center only available to Weill Cornell Medicine or NYP patients?
We do. It's actually open to the public, so we encourage people to um come in if they need to use the computer, they do need to show a photo ID. Um, but we do not bill for our services. Okay. And I wanted to emphasize the book club is that uh, it's a even though we originally started it for patients, we do have staff members and faculty come join us occasionally, and it's a fun discussion and a great way to interact with people. And we're all motivated to improve our own health. And by discussing these issues, it can really help. Um, and I mean, there's even been some studies that show that reading can lower blood pressure you know, and social activities for certain populations too can really help with isolation. So um, we Allison does a great job moderating the group.
It looks like we have another question.
Sure.
What community resources does the center provide to patients?
Well, we offer online resources as well, and people don't necessarily have to come in. They can email or call us up, and we can provide answers to health information requests. They also have the space, it's located in a clinical building, so it's an easy place for them to wait if they're going to neurology or dermatology um and yeah, I hope that answers some of it. And also the health seminars, those we really like giving patient outreach opportunities to help clinicians engage with the community. Um, I actually have an anecdote that, after one of our clinicians posted their YouTube video on their profile website at Weill Cornell, reportedly one patient actually, they got a new patient because they had viewed the video. So we like to say that may be you.
We do have another question. Ken apologizes for being a little late, but if you could repeat some information, how long has the Resource Center been around? I believe you said 2007, correct, Sarah?
2007. Yeah,
And then you have been mentioning that people can come to the center on the second floor of the Weill Greenberg Center. But is there a website or anything where they can access resources online?
sure. I'll bring up let me just go back to the slide. So we have a YouTube channel and we also have a website. So the website, if you're on weillcornell.org and you click on patient education, we're one of the things listed there, the Myra Mahon Patient Resource Center. And you can also go to this website.
I'll be sure as well in the follow-up email to post these links. You'll get a copy of the slides, but I like to put them in the body of the email as well, just in case you want a quick scan of to reference back to what we talked about today.
Mhm. Okay, I can also bring up if there's any other questions.
And for those who came in a little later, if you would like to ask your question on the mic, feel free to just do the raise hand button. I'm happy to pull you off the mic if you'd like. Sometimes I know it's a little easier to ask a question out loud if it's like a specific use case that you're interested in. And thank you to Diana, who just posted the link in the chat if you would like to take a look.
Oh, thank you, Diana.
Are there any other questions for Sarah while we have her on regarding the Patient Resource Center or even just library services? Diana has also posted information about the upcoming book club session that they're having. I'll share that as
Yeah, I'll
well.
bring
Thank
it.
you, Diana.
Sure, and I'll bring that slide back up. So we do encourage you to RSVP, but you can also just show up. We we typically have a nice small little crowd for these, maybe like 6 to 15 people. It depends on the book.
Random question. Do you know if this is available on Libby? I know we have access to that as well as a.
It's available. We all the books we choose are available through New York Public Library, and a lot of them are available in audiobook form as well as we do take that into consideration.
Perfect.
So I would recommend looking at NYPL to see um, what format it's available.
Thank you.
And this is actually a partnership, I should have mentioned. It's a partnership with the 67th Street Library branch. So it's great that we have that partnership, and it's great to connect with people from the community who may not always be patients right now, but sometimes are prospective patients or um, just interested in health.
Are there any other questions about the Patient Resource Center or library services? I'll give it another minute. Just I know it takes a little bit to type in a question, but you can also come off the mic if you would like. I don't see any more questions in the chat. What I will do, as always, will say, oh, sorry, we just got one. Never mind. I spoke too soon. Can patients be part of the book club via Zoom as well for those who may be unable to go in person?
At this point in time, no. We have it on in person only, and but that's something to consider. Maybe we'll have occasional online. I'm not sure. That it's up to Allison. Um, I think one time there may have been one person just kind of brought their laptop and zoomed in somebody who really wanted to be there, and that worked out fine. But for the most part, we're not really set up for hybrid. It's also meant to be more intimate discussions. So we don't, just to be clear, we don't record the book club discussions that because sometimes people are sharing stuff that's personal in nature. But and the health seminars, we record them and upload them to YouTube, but we always cut it off before the question and answer period. That way people can feel comfortable asking private questions or semi-private questions without being recorded. And I think I see Oliver is
Yes,
raising.
I am going to ask him to unmute. Dr. Fine, you should be able to come off the mic. Actually, just to make it easier, let me see if I can unmute you. You should be able to unmute Dr. Fine if you'd like to ask your question. I'm trying to see if I can do it for you as well. Oh, I saw it for a second.
Is it on mute
Yes,
now?
yes, yes, I can hear you. Thank you.
Oh, great. I was wondering about the accessibility for patients who need, translation. um, patients who come and uh, are there resources for Spanish-speaking patients, for
So
instance?
that's a great question. Medline Plus, the National Library of Medicine resource, it actually has a Spanish language interface as well as a lot of the same pamphlets in Spanish as well as English. And
Oh,
then
excellent.
depending on I can also I'll make a note to send you a link so you can take a look yourself as well. But it also has not for every topic, but for many topics, they'll have an English version, and then you can see languages, what other languages the same information is available in. So you don't necessarily have to know the language yourself, but you'll know it's providing a translated
Translate
version.
version.
Yeah, I mean, you do, of course, want to, when you can, use interpreters, in your own practice, but it's nice to have patient education handouts as well in other languages that are vetted by the National Library of Medicine.
Yes. Okay. Thank you so much.
You're welcome.
Are there any other questions before we wrap up? And of course, if you think of a question after we're done with the session, I will be putting Sarah's information in there. So please feel free to just reply back to the email if you think of something and want to ask, or if you are interested in perhaps partnering with the PRC, as Sarah mentioned before. It seems like a great opportunity to do some outreach for patients as well that way. I don't see any more questions. I'm going to wrap up today's session. Sarah, thank you so much for hosting today. Really appreciate it. A lot of great information about the PRC. I'll be sure to email everybody all the information that we talked about. So please expect an email from me with the links that we mentioned, as well as these contact emails. And I'll be sure to CC them so you could just reply back to the email. It should be pretty easy. But again, please feel free to reach out to either me or Sarah if you have any follow-up questions about today's session or the PRC or just library services in general. And happy to get you to the right person who can answer your question. Thank you guys so much for joining today, and hope to see you next week at next week's Sex Tuesday session. Have a good one, everyone.
Thank you.